Hello, this is Dr. Lewerenz. Good day, good evening, wherever you are in the country or world, I guess, right? Coming at you here from Rochester Hills, Michigan. Listen, if you're new to me, hit the button, subscribe, follow us, because we always bring you here at Longevity Health Institute and myself and my practitioners the best in functional, integrative, personalized medicine, really personalized good care to really get to the root cause of things. And what I want to talk to you about, because one of my patients today referred somebody and was asking about concierge medicine and how long I've been doing it and kind of what is concierge medicine and what, why, who, and what is it all about. So to start here, what we do here is really a functional, personalized concierge medicine, and a plan essentially that looks at you from a 30,000 foot view at 6 major systems, setting goals, tracking metrics and goals, and then also making sure that this unified theory of aging, which has to do with like DNA damage, immunity, structural aging, and essentially a lot of how should I say this, but detoxification and methylation aspects in your body. Okay, we always focus on those. So we will focus on prevention, we focus on wellness, predictability, okay, and keeping you living long but having a good health span. So not just a lifespan, but a good health span. Okay, so that's kind of our model here. Okay, it's 6 points. We do this with every patient that walks in the door. We're always teasing through genetics. We address hormones and gut health and nutrients, how you detoxify toxins in your body, mind-body connection, your spirit as a whole, how you sleep. Also, we address structural issues, okay? And we address a lot to do with your overall health, if you will, and put that together into a model that is going to be very individualized, very personalized, okay? And once that stuff is established and set, again, we have these goals that we're going to focus on, that we have all these things that we want to be protective and preventative and proactive about with aging, because we're all going to age and we're all going to die, but let's have a good health span. Let's extend and be well and not just live long and old and debilitated and suffer, okay? That's not what I think God wanted for us. It's not what you want for yourself. It's not what you want for your family and loved ones, and even for your children, because then they have to care for you, and you can tend to be, really, truth is, will feel like this, whether you are or not, a burden, right? And something that, I have a motto here. It always is, I want my patients to thrive, not just survive, but I want to create a ceiling for them in health and wellness that is, in generations to come, the floor of who's to come after them. Okay, so that your ceiling becomes your children's floor, okay, in health and just in life, okay, so because we look at all these things. So, but that's kind of our model here, but that's also concierge medicine, at least in a functional, personalized way here at Longevity Health Institute here in Michigan. But it's also, I want to really impress upon you something, is that we have the time, we have the passion, the interest, of course, but we have the time. You get dedication, you get time, you get direct contact, not just with me, literally on my phone, 24/7, text, call if needed. My concierge nurse, liaison, administrative assistant, you have all these direct contacts to make things streamlined, productive, efficient, and not miss anything, but also to make sure that we keep you on point and we keep you accountable, and make sure that we have set plans and quarterly visits or telemed visits or whatever. I have patients come from out of state that I see maybe once or twice a year. We do a lot of telemedicine, and we get testing done here, and if needed, outside in their state, wherever they live. But the point here is that concierge medicine allows me time to invest in you in the visit and outside the visit, okay? So not the average in primary care is 7 minutes, a 7-minute visit. You cannot do anything good in 7 minutes. You basically treat and street and Band-Aid. That's just the facts, okay? Our whole model here, visits are always at least 20 to 30 minutes, whether they're concierge or not. But the point is, with concierge medicine, we give you the time, the dedication, the good personalized care, the state-of-the-art diagnostics and therapeutics, cutting edge things, but it's real stuff. It's real science and physiology to fix you, to have you thrive and function, okay, and to really judge, kind of where you're at. A lot of us will feel well. A lot of men I have are very successful and healthy in general, and they're head driven. So, they're like, hey, doc, I feel great. You've helped this and this, but, I'm doing great or whatever. Well, we go deeper because we'll do a full genomic sequence. That's all your genes. Okay, that's 90% more of like 23andMe, your full genome sequence. So we know where you at from a biologic age, not just a chronologic age. So, where are you at in that? Where your telomerase and where your telomeres, these end caps of your DNA, are getting damaged as we age. So, if you're 50 out there, are you really 50? Or are you biologically 55 or 60? Even if we worked on some things and we're working on you, these things matter because then we know really what's going on inside. And one in our program's working not just to make you feel good, but to where you're at so that we can kind of readdress things, recenter ourselves, and set some new goals, okay? So, you can't get anywhere in life with your children, your family, your church, your spirit, your God, your health, anything, financially, your business, your whatever, if you don't have plan and attention and focus and follow some metrics, track some things. So that's what allows myself and my practice to really do in our model here is really, really vest in you. Okay, we're passionate about it. We love it. We're all about doing the right things, building a good culture here, helping my even employees and helping all our patients. Okay, but getting you to thrive and be healthy and be well. And, the sooner the better. The sooner we can detect things and treat them and test them and improve things, absolutely, not only can we get real traction and get results, but you will see impressive things. I had a gentleman today, actually, just one of my concierge patients, him and his wife came in, and they're within 3 visits doing lovely. Not that they had a lot going on, but some fatigue and some kind of dietary issues and trying to get some weight loss, and he's already down 10 pounds, and just some things were a little bit off in that, and he's a business owner, and he's 45, stressed a bit or whatever, but in 3 visits, he's already doing lovely. We're waiting on his full genomic sequence. That takes 10 weeks to get back, but we're gonna really be able to dig in and predict some things and be really preventative in him, and not just the typical, run-of-the-mill general preventative stuff, which of course we encourage, colonoscopies, stress tests, etc. But we're going to be a lot more detailed and be focused on exact in a personalized way. So that's what real good, at least functional, personalized concierge medicine is. Now, of course, I do common things. So common question I get, hey, can you write me a script? If I'm in Florida on a trip and I get sick, can I reach out to you? Can you call in something? Hey, when I have a little question about something, do I need to make an appointment? Absolutely not. It's streamlined, it's in real time, and it's supposed to really help you to stay focused on your life and your goals in that, and for us to stay focused on your health, your wellness, and really being truly preventative, okay, and prove it to you. So that is what concierge medicine is. That's what good care is. That's what you deserve. I believe actually in our healthcare system in the United States, concierge medicine, direct pay models are growing. And why is because, you're paying high deductibles, you're paying for things, but we're lacking that time and needed good care. And most of it, I believe, there's good practitioners and doctors and such out there, but they don't have the time, and they get burnt out easy. They're seeing 30, 40, 50 people a day. It's impossible to do good care doing that, okay? So that's where this trend has happened, not just in my practice the last 5 years. That's when we started concierge medicine, but, what's happening here in the country, It's growing about 5 to 7% per year in the primary care model. And there's many doctors just in this Michigan southeastern area that are doing a lot of direct pay models just for general medicine. And the reason is because it works and you're getting what you pay for and what you deserve. Here we get a little bit deeper, we get a little bit more focused on things, and we get, really doing true prevention and wellness for you. But that's what functional, personalized concierge medicine is. And one last tip and bit, I already said it, but I want to just tell you, everything comes from intention and focus and planning. Not one thing happened in your life or has happened in your life just because. I can guarantee that. You've had some attention and some focus and some mindset with it. The more you put energy into that, even into your health, but into anything, relationships, your business, your job, your personal relationships, okay? Your community, etc., that is going to pay you tenfold and with results. That's my tip for the day. This is Dr. Lewerenz. Be Well, Longevity Health Institute. Follow us here, subscribe, tell others.